Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. Welcome to the media in attendance this afternoon, and for those of you who are joining us for the first time, you can submit your questions by clicking here on Microsoft Teams on the text bubble with the question mark, and when you do, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those in attendance who are watching today on Rogers Television, as well as the Rogers YouTube channel and Facebook page. Listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. Now, you might imagine I was a little cranky earlier this week particularly when I spoke about the thousands of Moderna doses that went into the garbage due to a lack of demand. But on the opposite end of that spectrum, there is something I'm really happy to see, and something that I personally believe deserves a big shout out. And that's how well the 12 to 17 year age demographic in our London Middlesex area is doing when it comes to rolling up their sleeves. Now, according to the data from our Middlesex-London Health Unit, 82.4% of people in that bracket have at least one shot, and those with two shots are up to 65.6%. That's pretty good. And here's why. Both those numbers, firstly, are substantially higher than the provincial average, and at the local level, higher than any other demographic under the age of 40. So look, our young people get it. And with the new school year fast approaching, it's highly encouraging to know that so many have protected themselves and, of course, other community members by getting their vaccine. We remain concerned, though, by the higher case counts. And if you've been following over the last 5 to 7 days, you've seen not only that increase, but also 2 outbreaks declared at local bars. I'm of the firm belief that these types of venues should be off limits to those who are not double vaxxed. Yet, as I've also said, that requires cooperation and support from both the federal and provincial governments. It would seem as if momentum, though, is building on those fronts. So for me, and along with other big city mayors across Ontario, we've put forward a motion to request that mandatory vaccination proof be put in place, and we're going to continue to press for action when in discussion with the senior levels of government. Lastly, I'm aware the City of Toronto announced earlier today that with some exceptions, all of its employees must be fully vaccinated by October 30th. I can tell you that I'm actively reviewing the details of this announcement, and we're consulting with our senior administrative staff and labor partners here at the city. There's a number of factors at play, along with legal complexities, but as I've mentioned, it's under review. It's important, and discussions are being actively solicited with those in our labor organizations within the city. I hope we get to that place. So that's it for me for the moment, and I'll pass this now over to Dr. Summers, please.
Thank you, Mr. Mayor, and good afternoon, everyone. Good to be with you this afternoon. As always, I bring greetings from Dr. Mackey. Much to discuss today. MLHU is reporting 23 new cases, and we continue to see higher levels relative to what we were at even 2 to 3 weeks ago. Case counts are climbing across the province, with over 500 cases being reported by the province today. Although we are seeing some cases amongst those who are fully vaccinated, a majority of cases continue to be seen amongst those who are unvaccinated or partially vaccinated. As we see the Delta strain continue to circulate in our community, we will see breakthrough cases amongst the vaccinated. Doesn't mean that the vaccine isn't worth your time, though. People who are vaccinated are significantly less likely to get infected, and if they are, to get severely ill and, of course, to die. Getting vaccinated remains the most important thing that we can do for ourselves and for each other right now. We are also following very closely 2 large outbreaks associated with downtown bars and nightclubs, specifically at Delilah's and Love Lost on Richmond Row. The outbreak at Delilah's has risen to 22 primary cases with 4 secondary cases. Of those cases, 9 were fully vaccinated. The Love Lost outbreak has risen to 8 primary cases, all of which, to our awareness, were either unvaccinated or partially vaccinated. We are investigating both of these outbreaks closely to ensure full compliance with public health measures. Gatherings such as this are higher risk. Indoor activities where some people aren't vaccinated, where physically distancing isn't kept, and where masking is inconsistent are high risk activities. We've seen a notable jump in cases specifically amongst those ages 18 to 24. The nature of being 18 to 24 are that attending nightclubs and bars in downtown London or in other parts of our region is an important part of life. However, these are higher risk activities, and for those who are unwell or for those who are unvaccinated, I strongly encourage you to consider your actions when attending these events. And for those who are vaccinated, again, I would remind you that any indoor activity with those who are unvaccinated also places you at risk. So have those challenging conversations and make sure that those around you are also vaccinated. As I mentioned, we continue to investigate these outbreaks. The fall will be a challenge. Some modeling that hopefully will be seen at the provincial level over the next few days is suggesting that a 4th wave is imminent, if not well underway, and that the Delta variant will continue to wake its way through our communities, particularly amongst those that are unvaccinated or partially vaccinated, which again highlights how critical it is that we take advantage of this amazing opportunity to receive the vaccine. The health unit is reporting on Tuesday that 82% of those 12 and over have received at least 1 dose in our community. Nearly 73% of everyone 12 and older in our community have received 2 doses, a tremendous amount of readiness to receive the vaccine. There are, however, some age cohorts that haven't taken the vaccine near as ready, and some of those age cohorts are those that we're seeing the cases amongst. So again, those ages 18 to 35. So for those out there, we are focusing on ensuring that doses are where you need them to be. Our mobile clinics yesterday delivered over 250 doses, and 50% of them were first doses. That's tremendous to see, but we even want to go higher. This weekend, we will be on Richmond Row Friday and Saturday evening with doses till dark from 3 p.m. to 9 p.m., offering walk-up doses for first and second doses to anybody who's hoping to get vaccinated. We will on Sunday be partnering with Pride London at the Palisade to work with LGBTQ+ individuals in order to ensure a safe and supportive environment to receive the vaccine in a safe and supportive way. The vaccine is out there, it's ready for you. We just are asking you to roll up your sleeve. I want to emphasize, we are heading into a 4th wave. It's actually already here. And so I would strongly encourage people to, although if you are vaccinated as well, keep your contacts limited and outdoors, wear your mask, stay home if you're sick, because again, we are wanting to have a safer fall so that we can get kids back to school and keep our healthcare system operating. The pandemic has paid a toll for so many. One of the things that we're trying to highlight today is the impact on household food security that has that has increased throughout Canada, Ontario, and the Middlesex-London region throughout the COVID-19 pandemic, a disruption caused by disruption in income and stability. Household food insecurity makes people sick and is another example of how the COVID pandemic has had impacts well beyond the virus itself. Increased rates of diabetes, high blood pressure, heart disease, depression, and anxiety are seen amongst those who have household food insecurity. And it is critical that we recognize these and other impacts of the COVID-19 pandemic. MLH2 continues to support families living with household food insecurity with our programming, including our Nurse Family Partnership, which provides first-time young parents support during the first 2 years of life, as well as supporting other programs across our region like the London Good Food Box to try and ensure affordable access to healthy foods. Thank you, as always, for joining us Mondays and Thursdays for these media briefings, and I'm happy to pass things back to Mr. Clare.
Well, thank you very much, Dr. Summers. All right, we do have a number of questions in the queue already this afternoon, so let's get to those right away. The first question, Mayor Holder, is for you. It's from Jerry Dewan at CTV London, and I think it touches on some of your opening remarks this afternoon. Jerry asks, Mayor Holder, do we need to take a harder line when it comes to COVID-19 enforcement at bars, restaurants, and other places where people congregate?
Hey, Jerry, the answer is absolutely yes, we must take a harder line when it comes to enforcement at bars, restaurants, and other places where people come together. Look, it's a team effort because this is how it will have to work. Firstly, part of it's enforcement. So our bylaw enforcement officers, Middlesex-London Health Unit officials, they check various facilities to ensure that they're in compliance as it relates to masking and the like, and there's the distancing and the numbers. All of that is part of what they can do at the enforcement level. But let's say we get to that stage where vaccination passports come to pass. Then it will be a function that then the responsibility actually switches more over to the businesses, who you will have to take your phone and you will have to confirm in some fashion, if that's the way that it's going to be done, that you've had your 2 shots. Now, the good news is that for so many people who frequent restaurants, bars, and the like, they have cell phones, and they will have been notified that by the vaccinators, certainly by the health unit, that they've had their 2 shots. So I think the process is straightforward, but I think what all the restaurants and bars are looking for is the province to come forward with that and say, look, I mean, right now a restaurant or bar can do that. They don't have to wait for the province to come in and say that you need to be double shot. It's like coming in with a mask. An owner of an organization, a store, could say, I'm sorry, you're not coming into the store because you're not wearing a mask. And bar owners have the ability to say that now as well. But I appreciate they're looking for cover. What they want to have is the appropriate support from the senior levels of government that say, look, this is the way it's got to be. So I get that. But it takes a team to do this. So you need the province, who I believe is coming that way, in terms of ultimately confirming vaccine passports. You're going to see, you've got bar owners that are prepared to enforce that. And you're going to have bylaw and health unit folks who look at it from another perspective as well, from the standpoint of masks and size, crowd sizes and the like. So do we need to take a harder line? Yes. Is it coming? Yes. And, avoid the grief. Get your 2nd shot. Get your 1st if you haven't, because otherwise you're going to be alone. You're going to be very lonely because you're going to be somewhat of a pariah because you're not going to be able to go where the cool kids go. And that's, to me, more a function of when, not if.
Thank you very much, Mayor Holder. Let's go to our next question. Dr. Summers, this one is for you, and it comes from Nicole Lampa at CTV Kitchener. We welcome Nicole to our briefing. Nicole asks, Dr. Summers, what was the process that led to 10,000 Moderna vaccines going bad? Did you work in coordination as well with local pharmacies who were seeing their supply go bad? Other jurisdictions aren't being as transparent. Why were you being open about the wastage?
Thanks for that question, Nicole. I'm glad to have you with us from CTV Kitchener. As we noted, unfortunately, we did see approximately 10,000 doses of Moderna go to waste last week. A very regrettable turn of events. The cause of that was that the demand for vaccine broadly and specifically for Moderna declined dramatically, which meant that in early to mid-July, our throughput by week of Moderna vaccine dropped so precipitously that the amount of Moderna that had been taken from a freezer to a fridge to be thawed for use was not used in time. We saw this coming about 4 weeks before the wastage date and notified provincial and regional partners to try and find opportunities to use this vaccine. We increased our own local use and were able to get through substantially more vaccine than we anticipated we might. Our original projections was about 30,000 worth of Moderna wastage. We were able to get it down to 10,000. And again, this was linked to that precipitous drop in demand for vaccine in mid-July. We went from almost 55 to 60,000 doses of vaccine going out the door in a week to substantially lower than that almost overnight. So again, very regrettable, not something we were aiming for. At this point, again, we are now keeping much less vaccine thawed in our fridges. A majority of it stays in the freezer. But again, that 10,000 Moderna vaccines would have been used in 3 days in early July. Unfortunately, just wasn't the case at this point. With regards to the questions of transparency, again, I would highlight that MLHU aims to be as transparent as we possibly can. Often the only thing that holds us back is trying to protect personal health information. And we really do aim to be as transparent about the work we're trying to do. We got nothing to hide when it comes to trying to do the right thing to protect our population and to do our part to do the work well. So thanks for joining us.
Thank you, Dr. Summers. Let's go to the next question. Mayor Holder, this one is for you. It's from Jane Sims at the London Free Press. And I think, again, it touches on themes that you brought up during your opening remarks, but I'll ask the question anyway. Jane asks, this week, the province's top doctor, Kieran Moore, invited agencies and corporations to go beyond his bare minimum orders directing hospitals and schools to increase vaccination rates. And this morning, Toronto Mayor John Tory announced that all municipal employees must have both their vaccinations by the end of October. Jane asks, will you be making a similar announcement for the City of London employees?
Well, thanks, Jane. You know, it's interesting. It's easy to say yes. Let me back it up first, though. Firstly, Dr. Moore is absolutely correct when he talks about establishing this absolute need to direct various agencies to increase their vaccination rates. I suspect, though, not having spoken to John, that what you have here is a negotiation that the mayor has likely had with various union groups who have been pressing the city to make some decisions. And I would speculate that, again, to be fair, having not spoken to him, but that this has been a combined effort between the City of Toronto, the unions associated with this, and the health unit, and as well as the provincial health officer. I think I've been pretty clear my position on vaccination, so I don't think that's in doubt. And if I had the power to mandate it, that's one thing. In the same way, the Mayor of Toronto does not have the power to mandate this. It has to be through a cooperative discussion with his labor unions, because again, all of the power that we have as a municipality is directed through the province of Ontario, crystal clear. But if you have unions who are coming out to you and saying, we believe it is important that this be done, then basically what you get is you get some cover, if that's the right word for it, but you get, as long as you've got support from the unions, I think this makes it an easier statement. And if I could make it, I sure would. And I do know that those kinds of discussions are generally taking place. And that's why you've seen some decisions made at senior levels of government about enforcement, because it's being pushed on by the union groups. And I applaud that initiative, because anything that helps get us to greater vaccination percentages is a good thing, no matter how it gets there.
Thank you very much, Mayor Holder. And that, I know that it wasn't just the question from Jane there. We had about 3 other members of the media who had that same question. And one of those was a follow-up, Dr. Summers, from Daryl Newcomb at CTV London in response to the mayor's comments. Dr. Summers, as Associate Medical Officer of Health, what's your advice to London City Hall about whether to follow that lead, and also to the mayor's comments?
Thanks, Daryl, for that question. Clearly, we will continue to participate in conversations with our municipal partners, not just the City of London, but our county partners as well, around strategies to increase vaccination. As a health unit, we support mandatory vaccination policies as discussed and delivered with partners and through those negotiations, as the mayor has mentioned. It's critical that partnerships are built as we try and create safe workplaces and safe communities. But we do know that vaccination in congregate environments is absolutely critical. The Middlesex-London Health Unit, as an employer, has made vaccination mandatory for our staff. And we are trying to provide that example. Again, we think it's important. We know that there are discussions and challenges as we navigate all of this, and that those discussions are really important between employers and employees and partners as we make our way to maximizing our vaccination coverage. It's the most important thing we can do for ourselves, our workplaces, our peers right now, given the pandemic's wave. Thanks.
Thank you, Dr. Summers. Let's go back to our next question. And this is from Jennifer Beeman at the London Free Press. Dr. Summers, how many people are showing up at the Health Unit's mobile vaccination clinics? Is turnout still strong? And what proportion are receiving their first doses?
Thanks for that question, Jen. The numbers are still stable at our mobile clinics, slight drop off in the last little while, but we anticipate we might even see a bit of a bump as some of the new rules around what you can do when you're vaccinated come into place. Yesterday, as I mentioned, we saw over 250 people across our mobile vaccination clinics, and over 50% were first doses. Over the course of our mobile clinics in the last few weeks, it's been between 25 to 50% have been first doses. Again, highlighting how important these clinics are to increase vaccine uptake amongst those who just haven't had access. We'll keep you posted as we have more mobile clinics over the next few weeks.
Thank you, Dr. Summers. And also, because it's Thursday afternoon, I will take this opportunity to remind those who are tuning in that if you have not attended a vaccination clinic, there is one happening at City Plaza here at the Health Unit today. Continues this afternoon. You don't need an appointment. You can stop by and get your first or second dose, provided that it's been 28 days at least since your first dose was received, here at the Health Unit this afternoon. All right, next question, a follow-up from Jen Beeman. Dr. Summers, has the Health Unit seen an influx of 11-year-olds with birthdays in 2021 at clinics? Approximately how many people are in this cohort in London and Middlesex?
Thanks for that question, Jen. I don't have all those numbers for you. We certainly have seen an influx of those who are 11 turning 12 before the end of 2021. Don't have those up-to-date numbers on hand, and same with the size of that cohort. But again, we have certainly seen an eagerness for people and parents and kids in that age cohort to get vaccinated as soon as possible so they can be ready for school. If you are a parent with a kid in that age bracket, or if you're a kid in that age bracket yourself, walk-in appointments are available at all of our mass vaccination clinics, and feel free to stop by anytime.
Let's go to the next question. It's from Jane Sims at the Free Press. And actually, this relates to a media release that we put out a little earlier this afternoon. Dr. Summers, today's announcement of a pop-up clinic on Richmond Row Friday and Saturday, and a Pride London-sponsored clinic on Sunday, appears to be efforts to reach what you've called pockets of unvaccinated people. What else does the Health Unit have up its sleeve, and where can we expect to see clinics that reach hesitant people?
Thanks for that question, Jane. We're trying to be as creative as we can in order to reach people who are not yet vaccinated. The way that we determine where to go is based off of where we know people who are of an age who are in those lower vaccinated age brackets are spending some time, hence why we're on Richmond Row. When we look at our data quite clearly, that's a lower vaccinated population relative to some of the older age cohorts. We also look at some of our geographic maps to see communities and neighborhoods where vaccine uptake is a little bit lower than others. And that helps to inform where we place our clinics. So we are going to schools in neighborhoods where vaccine uptake has not been as high. We are going, as mentioned, to Richmond Row. We're working at the Palisade with Pride London. We're going to be at the London Air Show as well. We're continuing to be operating at City Plaza once a week in order to provide access to those in the downtown core. Starting this fall, we will be working even more closely with schools to make the rounds to as many schools as possible in order to provide COVID vaccine, not only to students, but to staff and families as well. That was consistent with the provincial announcement made this week that school boards should be partnering with public health units to support vaccines and vaccination clinics in schools. That was already underway for us, so we were able to continue the good work we're already doing. If you have ideas of where we need to be, of who we ought to be working with, of where you think we can do good work, please let us know, health@mlhu.on.ca. We'll take all the suggestions we can get. Our teams are continuing to try and work with community groups to try and build those partnerships. You're seeing that with the Black London Network and with Pride London and others, but we'll take any suggestions you can provide to us. We're always happy to partner. And again, that's health@mlhu.on.ca if you have any ideas of places mobile clinics can go.
Thanks, Dr. Summers. Mayor Holder.
Yeah, I have an idea, Dr. Summers. How about the Western for Agriplex? How about Nichols Arena? How about the North London Optimist? Folks, let's be super clear. This is not difficult. This is so straightforward to do. And while there may well be clinics that are available through mobile units, and it kind of makes it easy and convenient, let me tell you, just go do the right thing. You know, we are stretching the resources of the health unit to try to accommodate the lazy. And I get a little tired of that. I think at some point, people have to take personal responsibility. And as I said, there's going to come a point where people are going to be denied opportunities because they haven't had their double vax. And it's kind of like being, when my children were younger, you don't spank people. You know what you do? You just kind of restrict some of their ability to do certain things. You put them in the corner and say, you can't go out and do this, you can't do that. Well, guess that's going to happen regardless. So I really appreciate, and I sincerely do, the efforts of the health unit to try to make this accommodate people. But people, come on, go do the right thing. That's it, Tim.
Thank you very much, Mayor Holder. Thank you, Dr. Summers. We do have a number of questions still in the queue, and I just want to look at Dr. Summers and Mayor Holder. Are we good to continue? All right, here we go then. I'm going to combine a couple of those questions. Jane Sims and Jacqueline LaBelle, who's from Global News Radio, have a very similar question. So if it's all right, Jane and Jacqueline, I'm going to combine your questions. They have to do with the outbreaks at Lost Love and with Delilah's. So the question is, Dr. Summers, for the outbreaks, can you again go over how many primary and secondary cases are tied to each of those outbreaks? And are any additional infections or cases expected? And finally, are the infected people who are secondary cases, do we know if they're vaccinated or unvaccinated?
I'll try to give my best up-to-date information on all of that. For the Delilah's outbreak, we have 22 primary cases, 4 secondary cases. 9 of the 22 primary cases are fully vaccinated. The 4 secondary cases, to my recollection, were all fully vaccinated, but we'll have to confirm those numbers for you. For Love Lost, we have 8 primary cases identified at this time, no secondary cases at this time. We anticipate that the numbers of cases associated with the outbreak are higher than the numbers that we are currently reporting. We're under no illusion that there aren't folks that have likely not been tested that are out there, and that's why we're encouraging anybody who's been at Delilah's or Love Lost, particularly over the weekends of August 7th and 8th, but also last weekend, the 13th, 14th, to monitor yourself closely for symptoms and test yourself and go for testing immediately if you develop any symptoms. These are highly transmissible events that we've witnessed. It's absolutely critical that if you were in attendance at these facilities, if you're a staff at these facilities, that you get yourself tested if you develop any symptoms associated with yourself.
Thank you very much, Dr. Summers. A couple of questions now about the rollout of third doses. First, Jennifer Beeman at the London Free Press. Dr. Summers, third doses will be made available to select Ontarians soon. Will the health unit be involved in this rollout, and what is the plan?
Thanks for that question, Jen. Yes, indeed, we will be involved with the rollout of third doses. At the moment, third doses are approved for select medical conditions that have immunosuppressive characteristics, which mean that the vaccine likely did not work as well as it would in others. Those medical conditions are contained to hematologic malignancies currently undergoing treatment, people with a history of transplant, and individuals on a medication called anti-CD20 medications. Those individuals will be contacted by their specialist provider in order to facilitate vaccination. So again, it is not something where you can simply show up at a mass vaccination clinic to receive a third dose. These must be facilitated through your specialist. So if you are one of those individuals, make sure you speak to your treating physician. We'll be communicating more with healthcare providers over the next weeks in order to ensure access as necessary. But again, this is not the case where one can simply show up to a mass vaccination clinic. It has to be facilitated through your treating provider. The other eligible group for third doses are residents of long-term care homes and select high-risk retirement homes and First Nations elder care lodges. High-risk retirement home in this instance are those with a memory unit or who are co-located with a long-term care home. We will be distributing vaccine directly to those facilities to distribute to their teams. More information will be sent out to those facilities tomorrow so that they can start ordering vaccine as early as next week to deliver to residents of those facilities. So yes, indeed, we will be involved. That plan is rolling out literally as we speak. Our hope is that we will be well on our way to providing third doses to those that are eligible within the next 1 to 2 weeks prior to Labor Day.
Thank you very much, Dr. Summers. And I think that answers the first of Sophia Rodriguez's questions from CBC London in terms of when can long-term residents expect to receive those third shots. So again, in the next week or two. Follow-up question from Sophia Rodriguez, Dr. Summers. Do you anticipate Canada approving booster shots for the general population, or at least for healthcare workers? And are they needed? Not healthcare workers, the extra shots.
Yes, healthcare workers absolutely needed. Sophia, thanks for that really important and timely question. We're hearing, as you know, out in the United States that booster or third doses will be provided to some people in the population. It's a really evolving area. The science around the importance of the booster shot remains new. I think we're still collecting information on that, particularly for Canada, where many of us actually received our second dose not 3 or 4 weeks after our first dose, but quite a while later. And in fact, that probably will help us in the long run with regards to keeping our immunity a little bit higher. The key thing in all of this is that while we in Canada have the benefit of so many vaccines that we are actually able to even think about third doses, there are still countries in the world where vaccine is not readily available. And until the entire globe is vaccinated, this pandemic isn't over. If there is rampant circulation of the COVID virus in other parts of the world, we will see new variants. And we're already seeing what that means with regards to a fourth wave from the Delta variant here in Ontario. So it's absolutely critical that we also ensure that vaccine is readily available across the globe. Now, I'm not responsible as the Associate MOH of the Middlesex-London Health Unit for what happens across the globe. I'm responsible, of course, for what happens here in some ways in partnership with others, of course. And here, we will continue to follow the evidence and pay attention to provincial and federal recommendations around those third doses. And as always, the health unit will activate and operationalize whatever is necessary in that instance. At this point in time, I do not know whether or not booster shots will be required or recommended for the general population. We're following very closely provincial and federal recommendations in this area.
Thank you, Dr. Summers. Another question from Jen Beeman at the Free Press. Dr. Summers, is there any evidence of first dose drop-offs? That is, folks who come out for one shot but don't come back for their second. Is this an issue here?
Thanks, Jen, for that question. I think there is slight evidence that some people will have received a first dose but have not yet come back for their second. We, however, have the benefit of knowing who got a first dose. And so we have been gradually calling out to people who have not come back at the anticipated time for their second dose to try and book them in at a time convenient for them to get their second dose. So we're working to try and follow up on those people who received a first dose but have not yet received a second. So those phone calls and conversations are ongoing and will continue well into the fall. On the whole, we are seeing in age cohorts that have been vaccinated for the longest that a majority of people who received a first dose come back for a second. The difference is only about 1% to 2%, which can be explained by lots of different things. So on the whole, most people who get a first dose get a second, which is really encouraging. So if we're sitting at 82% of those over 12 plus who've received at least a first dose, we should approach 80 to 82% of people who will receive a second dose. But again, we're tracking that very closely and some phone calls are being made.
Thank you very much. Just a couple more questions in the queue. The first is a multi-part question, and it comes to us from Jan Sims at the Middlesex Banner, and we welcome Jan to the briefing today. Dr. Summers, on August 11th, Ward 5 Councillor for Middlesex Centre Brad Scott put forward a notice of motion at the Middlesex Centre Council meeting that goes as follows. I'd like to make a motion that the Middlesex Centre mask bylaw be amended to allow for optional wear indoors. Jan's questions are, what's the MLHU position on optional masks indoors? Can a municipality make masks optional? Why are masks considered important indoors? And under what circumstances is mask wearing now optional indoors?
Thanks for that question. The requirement for masking in indoor environments is a provincial requirement, and therefore it is not a decision for local municipalities. It is a provincial requirement that masking is required in indoor environments. It's really important that we continue to remain masked throughout the next number of months. Masking is not something that we would consider to be optional in an indoor environment. Critically, masking is not so much about protecting you, but it's about protecting those around you if you happen to be sick with COVID-19. The use of masks in indoor environments is particularly important as something we call source control. So if I had COVID-19 and I was wearing a mask, I would be protecting those around me from getting COVID-19 by wearing a mask. And that's why it's important that wearing masks in an indoor environment is not an optional thing, but a mandatory thing so that all of us can protect each other. As I mentioned, at this point in time, it is not optional to wear masks in indoor environments where the public is gathered. That is a provincial requirement, and that provincial requirement certainly supersedes local input at this point in time. Thanks, Dan.
All right. Thank you for the question, Jan. Okay, and our last question from Daryl Newcomb at CTV News, and it relates to the mandatory vaccination policy at the Middlesex-London Health Unit. Dr. Summers, did the Middlesex-London Health Unit hold discussions with QP Local 101 prior to implementing its vaccination mandate?
Thanks for that question, Daryl. MLHU has engaged and had discussions with our union partners throughout this process, and they have certainly been aware and notified of all discussions and advancements in these policy development.
Thank you very much. And that does bring us to the end of the questions. 10 minutes of overtime this Thursday afternoon. Mayor Holder, Dr. Summers, thank you for sticking with us and working through those questions, also for your insights and your thoughts this afternoon. That does bring us to the end of today's virtual media briefing. Thank you very much for your attendance. A quick reminder that the Middlesex-London Health Unit will be hosting another Instagram Live tomorrow at 12 noon, and we will be joined by Dr. Alex Summers and Alex Kopach, Olympic gold medalist in the two-man bobsled at the 2018 Winter Olympics. And Alex will be joining us to discuss his experience fighting COVID-19. It'll be a lively discussion. We'll welcome your questions as well. That's on the Middlesex-London Health Unit's Instagram account tomorrow at noon, and that will be hosted by Alex Timmel. So Alex Timmel, Dr. Alex Summers, and Alex Kopach. It's going to be a trio of Alexes for you on Instagram tomorrow. That'll do it for us today. We'll be back with our next virtual media briefing on Monday afternoon at 2 o'clock. Between now and then, have a great rest of your Thursday, an excellent weekend, and so long for now.